Hi, everybody. I'm Nuran Nadir. I'm the Director of Simulation at JUMP Simulation in Peoria, also the Fellowship Director for Simulation at University of Illinois. I'm also in emergency medicine by training. And just want to kind of give you a quick, I guess, overview as to why I got into this. I trained in an accounting program. We had no budget. That's why I have no disclosures. We're then. Thankfully, we're a little bit better now, but we still, budgeting for simulation for us is always a little bit of concern, which is why I got into, using kind of less traditional methods for creating models. One of the models that I created with the help of one of my residents, as well as actually my husband, who's very, very good into like creating things, is the peritonsillar abscess model. To date, I don't think there's any other model like this. I've actually looked at formal models too to see if I could find something like this, and it just doesn't exist. So I'm going to briefly go over it a little bit just to know this was created in 2013, and since 2013 we've kind of given labs on this, sim labs in our shop almost every year. So we've had about 5 years of experience with it, and it goes down really well. So the other model I'm going to discuss a little bit later is the lateral canthotomy model. So it's actually really simple. You see bubble wrap. I got that from my Amazon boxes because I'm Amazon Prime customer. I get lots of Amazon stuff. So we had some bubble wrap laying around and zip ties. And that's really the basis of using creating the peritonsillar abscess model. You basically, you have to first decide where you're going to use the peritonsillar abscess model, where you're going to place it. So is it going to be a mannequin? Is it going to be a cup? We have like coffee cups that we can use. You have to kind of measure, kind of get some idea of how wide the mouth is and how deep back you need to go. And based on that, basically, measure out and cut out a strip of of bubble wrap. After that, you basically thread your zip tie through it, okay? And there's a reason we do it with the zip tie. I'll tell you in a minute. Each of the bubble wrap, you basically withdraw the air from it, and you basically fill it with chicken soup or something similar, okay, to simulate the pus. You kind of seal the little hole with something like crazy glue. It's really cool. You let it dry, of course. Okay, this is just kind of showing how you withdraw the air and fill it up. That's what it eventually looks like. And then once you have it, it's dry, the crazy glue is dried off, then you basically, I actually work with liquid latex. You can work with dragon skin. That's equally useful, but for me, it was really cheap to get liquid latex off Amazon. I got like a 1-gallon bottle for $30, and I'm still using it after 5 years. So, I just used that. But of course, if you have a latex, allergy, just be careful about that. That's what liquid latex looks like, okay? You can try to color it a little bit if you want to make it inflamed. You can certainly do that. You can do any kind of paint you like. I just use food coloring, okay? And then if you can see, this is our airway TAS strainers, the ones we use to intubate. And the reason we use a zip tie is that you can just kind of like fit it in there and it'll just hold. You don't have to hold it back. The only problem with this is you got to be really careful. If it's a brand new TAS strainer, you just want to make sure it's nicely lined up, because if you spill some of that chicken soup in there, it's probably going to grow fungus. So just have to be careful. I use my old battered TAS strainers for this. And the other thing is, because we're using liquid latex, if you put thick enough layer, you can actually go a couple of times with it. So you can actually have a couple of people, do the needle drainage. So it's pretty cool. The other thing about it is, so usually most people don't get bilateral peritonsillar abscesses. So what I try to do is I always try to have like one person drain one side. So it actually really helps. It's also ultrasoundable. It looks a little funky on it, but you can actually identify the fluid pocket if you really want to use it. So that's what it is. We don't have an airway TAS strainer here, but you guys will get to practice using our little coffee cups. Okay, so this other model, that Halloween lateral canthotomy model, is, again, it's an interesting one. It comes up now and again for trauma. Where I trained was a big trauma center, and we needed a way to teach our residents how to do it, and I needed something super cheap. So at the time, we kind of went shopping on Amazon and just kind of hit on the sort of cheapest thing that was available. It sounds like after Halloween, or right after Halloween, is the best time to go shopping like Walmart or like on Amazon, pretty much you name it, party stores. And you can get these models anywhere, like the masks anyway, for about $2 to $3. The ones that I got recently were more like $4 or $5, but still fairly cheap. So this is really what you need. You need a mask. You need ping pong balls. You need scissors. You need ideally a white hair tie. It could be any color. A needle with a thread or suture material. I just used a mannequin head because it was easier for me, but because it's a mask, you can actually put it on top of your actual mannequin, your sim man. You basically cut out the eye part of the mask. You stitch up the hair tie, okay? You take the ball, you basically shove it in there. This is a Kennedy mask, by the way. And you basically fit the mask over a styrofoam head or a mannequin. That's what that looks like. And then if you're doing it on a styrofoam head, somebody has to hold it while the procedure is performed. It's super easy to do it. And the good thing is that we actually have done it a couple of times. We actually ended up publishing this, and those are the references if you want to look it up. And of course, when you come back to the table, you can definitely practice. So, all right, handing off to Julie.